Hey everyone, Dr. Melanie Crites-Bachert here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology here in Portland, Oregon, coming to you again with another segment of what can you expect after pelvic organ prolapse surgery. So ladies, I'm talking to you. Okay, you decide to take the plunge and you have your pelvic organ prolapse repaired with surgical intervention. So what can you expect after surgery? Well, that also depends on the way the surgery was performed. Sometimes it's performed through little scopes or little incisions through scopes in the abdomen. If that is the case, then what you're going to want to do is you're going to want to keep your bowels regular. And that can be accomplished by any number of things. Colace, stool softeners, senna, laxatives, milk of magnesia, Miralax, magnesium citrate, prune lax, prune juice, whatever your flavor is. If you're taking fiber, you want to drink plenty of water with it because fiber can also be a bulking agent, and that's the last thing that you want to do. You can expect your abdomen to be tender because that abdomen is distended with gas. So when all of the air is released, your abdomen can feel very, very sore. You can also experience vaginal discharge if you had a hysterectomy. Don't be surprised if you see vaginal bleeding. When you need to worry is if you're seeing abnormal vaginal discharge, different colors, yellow, green, brown. If you're experiencing fevers, chills, nausea, vomiting, malodorous vaginal discharge, you're going to want to let your doctor know. You might also feel very, very lethargic and drug out for several weeks. It's because it's a very big surgery. Most patients bounce back quite nicely, but just keep in mind, you put your body through a lot of trauma and it needs time to recover. So don't be alarmed if you poop out long around noon or 2 o'clock in the afternoon. That certainly can happen. You might also be a little slow going, meaning that you don't have quite the energy to get up and do things. That's okay too. Make sure you eat right, or at least eat as much as you can. If you're a little sick at your stomach, which can happen after anesthesia, then try a bland diet with your breads and your broths and rice, things such as that. If you had vaginal surgery, meaning that your surgery was accomplished through the vagina, you will experience vaginal discharge, and that can last for as long as the stitches inside the vagina are present. Typically, those stitches will dissolve on their own, but while they are dissolving, they can change the pH in the vagina, so that can create a malodorous vaginal discharge and kind of an unusual discharge. If that happens to you, you're going to want to let your doctor know because that needs to be treated with an antibiotic. If you start seeing large, dark, thick clots, you're going to want to let your doctor know as well because, again, that may not be normal. You may go home with a catheter, so if that's the case, you're going to want to, again, keep your bowels regular, keep your bowels soft, and I will caution you, do not use an enema or a laxative suppository because if you had pelvic organ prolapse repair of the rectal wall, you don't want to disrupt that repair. You're going to want to keep your bowels regular. If you've got a catheter, you may see some blood in the urine. You may also feel like you have a urinary tract infection. You can use a heating pad to the abdomen. You can take some over-the-counter AZO to keep the urinary system numb and comfortable so that you can tolerate the catheter a little better. That's about it. Be healthy. Just take your time. Be patient with your body, and I hope this helps. Take care, everyone. Until next time.